If you were watching this video, it's because you were probably setting up for an Exalt case, holding Exalt in the middle of the case, or watching this because you have an Exalt case later. For this video, we're going to talk about the items that you need and then a quick setup. So as you can see, I have an Exalt in my hands. These come in these sterile tall packages, which are located in the inventory room, right off room 4, and right adjacent to room 2. These are hung up on hooks in 2 different locations, and as you can see, you have 2 additional packages located on the sterile package. For these procedures, you need the Orca air, water, and suction valve, which will be compatible with the Exalt scope, and you need the Exalt compatible auto cap locking device. You can tell the difference between this one and the reusable locking device through the color. The reusable is going to be a dark blue. Ours, for Exalt, is going to be a turquoise, which is similar to the umbilicus cord of the Exalt. These are all located in the inventory room, but you have additional in the very back on the wallman side. So when you are getting ready for an Exalt case, you can remove the scope from the package along with the 2 additional devices. Once removed from the package, you are going to go toggle side up and you are going to plug into the Exalt processor. From there, you are going to go to the black switch box and hit the 1 button, which is going to change the monitor setting to showcase the Exalt. If you need to use SPY with Exalt, that is going to be button 3 and 4. The other additional thing that you need to do on the endocart is change the green G gastro box from the D to the A position so you can capture pictures with the Exalt scope. From there, you have your suction and you have your air water insufflation, very similar to a reusable scope. When you are setting up, this is a brand new package or a brand new device right out of the package, so it is going to be slightly stiffer. One way to help overcome that is do some scope yoga and work the dials of the scope prior to the physician starting the procedure. From there, it's going to work very similar to a duodenum scope. The other additional thing that you can do is there are monitor optic settings where you can change the brightness, contrast, saturation, and color. There will be a little card hanging here that will show you the correct settings to optimize the image of Exalt. At the end of the procedure, make sure that you change back to the original settings. You press the menu button, use the arrows, use the plus sign, use the arrows to change the settings. Once you want to exit the screen, press menu again. At the very end of the procedure, remove Exalt and you can discard this. At some point, I'm going to work with you guys to set up an Exalt recycling bin so you can recycle these scopes. Thank you.